Staff engagement is critical in the delivery of compassionate, safe and effective patient-centred care. Justice Health and the Forensic Mental Health Network has made a serious investment in quantifiably measuring and monitoring our organisational culture, drawing upon the perceptions and experiences of staff and patients and the observations of partner agencies and stakeholders. The goal is to foster a culture that generates transformational engagement, whereby staff feel valued, respected, safe to question, willing to explore and test out ideas. They know their contributions are integral in achieving the organisation's priorities. This is ambitious. It demands vulnerability, willingness to expose fundamental flaws within the ingrained patterns of behaviours and to suffer learning anxiety and to fail. It also promises high rewards, high performance, satisfaction and improved health outcomes. All of this is within the context of political and structural reforms, fiscal constraints and public accountability. An average day in the world of healthcare. So in this presentation, we will share with you our reflections. I strongly hold the belief that reflective practice is the essence of discipline, that without reflection, we are likely to miss the subtle cues, to focus on the short term, with the learning and responsings tending to be reactive rather than generative. It's our intent to critically appraise our experience of working with the Essentials of Care program as an enabler of the organisation's priorities and staff engagement. To guide the reflection, we will use this simple model of inquiry. What, so what, and now what? So today's purpose is to showcase working with the Essentials of Care. The focus of EOC is at the individual or the microsystem level of care. In this presentation, I'm going to ask you to join me on the balcony to observe the interrelationships, how each system influences and is influenced by the other, and invite you to consider the possibilities of EOC as a whole of system enabler. So introducing our network, we provide a statewide service within the custodial, inpatient and community settings. We have formal and informal networks, and we work alongside government and non-government agencies. Since 1994, we've had significant growth and expansion. We've been rebranded 3 times, we've built and opened 2 new hospitals, we've pioneered services and innovative models of care, and our workforce has quadrupled. So although we're small, we do tend to do things in a big way. Going from a family business to an enterprise is a significant cultural shift. There's a grieving process, there's a letting go, and there's a building of trust. So our commitment has been to understand and improve the workplace culture and engage the staff through a series of climate surveys, gathering the staff perspective and the patient experience. There's been staff consultations through the process of gathering our values, understanding the behaviours and identifying priorities. This has been a staff-led process with planning and reporting. So in establishing trust and modelling transparency, which was very important, values were the linchpin. So drawing on 104 consultations that were facilitated across the state, we were able to come forward and craft our values. Within these values, we were also able to articulate the behaviours, what they did and did not represent. Through the process of the climate surveys, we're also able to test our progress against these values. And in accordance with the commitment, the climate survey, we've been able to monitor and hold everyone account. So looking at our EOC journey, which you will notice is a parallel to our culture improvement journey. The Justice Health and the Forensic Mental Health Network commenced with the Essentials of Care in 2009. Within that process, our organisational culture was in a reactive phase. And within that, our organisation took an approach which was usual to them, which was about doing a statewide roadshow and gendering people to come and join the program. Through that process, we were able to bring on board a number of facilities, but there was also a number of facilities and people that we were unable to connect with, and it was a difficult journey to commence. In 2010, we did an evaluation of our process to date, And at that time, we identified in regard to the relevance and readiness of the organisation to be able to engage with the Essentials of Care program, what the learning needs were and how those needs reflected our culture. We identified that there was a significant learning needs in regard to understanding practice development, understanding the tools of facilitation, and being able to engage in those within the workplace. So as you can see, our journey then moved forward in regard to action planning and looking at our areas of focus. So from that evaluation, we came up with 4 areas of focus. One was we needed to define our purpose. In 2009, the steering committee commenced the Essentials of Care program utilising the workbook that was provided by NAMO. So we didn't actually adopt in regard to our own goals or objectives. So we needed to define our own purpose for the Essentials of Care. We needed to support those early innovators, those people who had taken the concept and run. We needed to build capacity. We needed to work with our staff and be able to think about how do we build capacity across a statewide service in being able to work with this new way of working. And we needed to think about how do we leave a legacy. The organisation had been engaged in a number of activities that had come and go, and we needed to show how these all joined together. As you'll see, we progressed from there to looking at the alignment, which seems simple when you look in reflection, alignment of the culture improvement, the patient experience and the quality improvement initiatives. So through our evaluation report, we were able to identify ways of integration, looking at how we can interface with the network workforce development programs, the strategic plan and the national standards. So in 2012, our Essentials of Care achievements were presented in an evaluation report to the executive. We were able to show, obviously, a number of quantifiable outcomes, but it was also looking at, well, how does this fit into the bigger picture? Similar to our colleagues from Southeastern, what we came up with was an integrated governance model. So within that process was identifying how, with our vision of excellence and expertise and in alignment with our values, how the Essentials of Care could be an enabler to enable us to achieve our strategic directions, our requirements around our service level agreement, and also to meet our national standards. The other component was working with the organisation as an enabler was the ability to work with the data that was being presented. Facilitation of staff engagement in regard to looking at the feedback that received from the culture survey, from the patient experience, and an opportunity for teams to be able to look at what does this data mean to me? What are the conversations that we need to have? And where do we want to go? So it was an opportunity for the facilitators to build the ability to facilitate and sit with the data and to come up with action plans. So as an organisation in regard to our culture improvement, we eventuated from that process with 88 action plans from across the state. So again, that was another signal in regard to integration. So what are the ways that we could work with the Essentials of Care and with our Focusing on Care, which is our culture improvement initiative? So in looking at that process, we were able to look at what the staff had come back in regard to what were the items that were really important to them, and that was around communication, teamwork and support, recognition and accountability. And then looking at what was important to the patients, which was around communication, continuity of care and quality of care. So obviously through that process there's a number of similarities, and through the Essentials of Care we could work with the teams in regard to their ways of working, looking at ways to evaluate and looking at how to put that into process. So what did we learn from this process? And I think one of the, again, the interesting component is having the opportunity to reflect and to bring together the 5 years of work into a 15-minute presentation is a really interesting component to bring that together. So one is that change is a long-term investment, and I suppose in looking at the diagram that we have there as an organisation, starting from a place of regulatory compliance or status quo, which we're achieving and we're ticking all the boxes, to engaging, and I think as an organisation we had a number of false starts, and particularly in looking around a project mentality. And at the moment I would say we're at an integration and a strategic alignment. We still have way to go in regard to traction. which will head us towards our goal of high performance. The other part is about choosing the right approach. Initially, there was a concern about taking a transactional approach or telling and selling the program. On reflection, it is about starting where people are at. And at times, the transactional approach is an approach that is most appropriate for the culture and for the people. But it is about having a strategy that is about developing the people and enabling a process where people can move towards a more transformational and co-creation. The other of interest was around ways of thinking, in particular thinking around systems thinking and thinking differently. Through the Essentials of Care provides a number of strategies to engage people to look at the same problem but look at it differently. Through thinking through different styles, through different data, bringing in different voices is an opportunity to be able to look at an issue, a concern, at something that's going well and truly understand it and be able to replicate it. The other around influence, the interdependencies, that we cannot be looking at one part in isolation of another. I think it's really important, as the statement says here, that the quality and value of care produced by a large health system can be no better than the services generated by the small systems of which it's composed. And we look at that in regard to our organisation, but within our organisation, we're actually a small part of a larger system, obviously being New South Wales Health. The other part was in regard to alignment, as has been mentioned numerous times, around quality improvement, CPI, redesign, the processes of improvement. It's really important that evaluation is not optional, it's critical. And we need to be mindful of the end user, the person on the floor. What are the tools that they need to achieve and to understand their work, and how can we best facilitate that process? So now what? Where we're at the moment is looking at, as I said, in regard to approaching a whole system improvement. So looking at the whole of the organisation and looking at it in its totality. And I suppose what we're looking at is around, from an emancipatory approaches, what we're looking at there is about trying to see the possibilities, not being constrained by what's in front. Taking the opportunity to step back, to find that space to think and learn, to observe and to reflect. In this way, we're looking at ways of transforming how we know things, so then we can learn and we can change. The next step is also in regard to our organisation's strategic plan. As you can see, each of our strategic directions, the essentials of care and practice development and quality improvement, all are enabling components to support the clinical services, the workforce and the research plans of our organisation. There's opportunity for engagement in regard to the patient experience and in regard to the patient-based care challenge. So one of the most important messages, I suppose, is in regard to the interdependency. So I want to finish where we started from there and thinking in regard to the common purpose. So engagement is and was our priority. And in thinking about engagement, it is about cognitive, emotional and behaviours. So it is the hearts and minds and hands. The Essentials of Care provides a framework for people to be able to work within their hearts, their minds and hands. And it is about how each system impacts on the other systems. So in closing, engagement is a personal decision. It's not an organisational decision. And as you can see, one of the most important components from that smile on Alita's face there is about supporting staff to care, to improve and to innovate. Thank you.